Yes, indeed. This is Professor David Steinberg from the SteinbergFiles.com talking to you tonight about the upcoming election between Barack Obama and Mitt Romney. And I think you can cast your vote based on one question. One question if you're undecided, you're moderate, what have you. If you're not sure who you want to vote for, just ask yourself this question. Who do you want to choose your health care? Your doctor or Joe Biden? Because if President Obama is reelected, it will be Joe Biden or someone like that choosing your health care. Now, to explain why, I've got to tell you a little bit about Obamacare, and particularly something called the Independent Payment Advisory Board. Incidentally, I should point out Martha Raddatz, the quote-unquote objective, quote-unquote moderator for the vice presidential debate. Did you notice? She didn't ask anything about the incredibly unpopular Obamacare law. She sure did ask some questions about abortion now, didn't she? But nothing about Obamacare. Could that be because when Barack Obama was in law school, they were friends? Well, I'll let you decide. Let's talk about this Independent Payment Advisory Board. When Obamacare passed, Obama took, or more accurately I should say stole, $716 billion from Medicare to pay for his transformative Obamacare agenda. That was your money that you paid into Medicare, and the Democratic Party and Barack Obama took it. So there is $716 billion less dollars in Medicare today than there was when Barack Obama became president. Well, if there's less money, there's going to be less care. Makes sense, doesn't it? Thus, we come to the Independent Payment Advisory Board, or IPAB. Never heard of it, have you? Well, why would you? The media won't report on this stuff, but I'll tell you about it and I'll link to it. The Independent Payment Advisory Board is a 15-member United States government agency, an appointed agency to be appointed by Barack Obama. What is it that they are supposed to do? These 15 bureaucrats are supposed to do. They are supposed to reduce Medicare spending. That's their goal. That's what they're there for. That's what they are going to do. Medicare and Medicaid spending, I should say. So it's going to be the elderly, the sick, the most vulnerable who are going to be hit by this. Not only that, under Obamacare, more and more employers are going to dump their health care on the government. So ultimately, this board is going to be deciding what care everybody gets. And their job is going to be to ration it, is going to be to deny care. That's their job. So, for example, let's say you're somebody, you or your parents, or somebody in their 60s, who needs open heart surgery. Well, you don't really need it. You've lived a long life. We'll just give you, oxygen, palliative care, oxygen and some pain pills, and, you'll make it as long as you will. What if you're somebody who's in their 70s and has terrible hip pain and needs a hip replacement? Well, you're in your 70s. You don't really need that for anything. Just take some pain pills. That's what this group is supposed to do. It's a 15-member group. It's not elected, so it's not accountable. It's to be appointed by President Obama. It doesn't have to be doctors either. In fact, I suspect a lot of the members are not going to be doctors. They are going to be big, loyal Democrats. And the person that just leaps to mind as the kind of person that would wrap up their career of long Democratic service on this board is someone like the Democrats' senior statesman, Joe Biden. I mean, thinking of this guy as a senior statesman for anything is kind of frightening, isn't it? But that is what it's for, and that is what it's going to do. Now, I'm posting you a link to the debate on Thursday between Paul Ryan and Joe Biden. I want you to take a good hard look at Joe Biden. The more you find out about Joe Biden, the happier I am. And I want you to ask yourself this simple question. Today, it's your doctor who decides what health care is appropriate for you and what is not. Under Obamacare, it will not be. It will be the choice of a government bureaucrat like Joe Biden. Now, if you want somebody like Joe Biden, this person you see on the tape, if you want that type of person deciding your health care, then I would say definitely go out and vote for Barack Obama, because that's what you're going to get. That's what you're going to get, and that's what your parents on Medicare, or if you're on Medicaid, that is what you're going to get. If you want your doctor to make your health care decisions, you have to vote for Mitt Romney and Paul Ryan. This is Professor David Steinberg of the Steinberg Files.